Good afternoon. Thank you so much for meeting with us today. We're here to talk about, I'm so sorry.
Take two.
Stop. Good afternoon. Thank you so much for meeting with us today. We're here to talk about the expansion of Memorial Community Hospital's budget in Keene, Missouri. As Native Missourians, we pride ourselves on being self-sufficient while doing our best to take care of each other. At Memorial Community Hospital in Keene, Missouri, our vision is to advance our community's overall health and well-being by providing accessible, affordable healthcare for our Keene residents, no matter their needs. We listen to the community's needs and do our best to service them. We know that in rural Missouri, people are driving multiple hours to receive necessary healthcare. We want to lessen the obstacles that they have to face as much as we can. Our mission is to show the community that we care. We're an organization that takes pride in what we do, how we do it, and who we serve. We are dedicated to providing high percentage of governmental and uninsured patients, and we strongly believe in helping the underdeserved. Our culture is contagious. Patients who have only visited us once can immediately feel how the MCH is unique. Our hospital staff treats patients like patients, not like numbers in a system. At the MCH, every employee is a member of our hospital family, and we work hard to extend that relationship to every patient that walks through our door. We are resourceful. While the billion-dollar health systems make deals, we make do. We do not solicit charitable donations. We do not put a lot of money into fancy facilities. We do not buy new if we can find it used, nor do we own our own insurance company. We do not have $1 million foundation providing financial support. We earn every dollar we use to run our organization by providing quality care to patients who visit our hospital. That is why we need your help.
So we are here today to discuss the necessary support that Memorial Community Hospital needs to take in order to keep serving the community successfully. At MCH, we pride ourselves on being integrated in our community and find benefit in listening to the needs of our fellow Missourians, creating the most accessible and serving environment possible. Because of this, we offer a holistic range of care that allows us to serve the entire community. We provide acute care, emergency care, home health services, diagnostic testing, surgical services, laboratory services, hospice care, and therapy services. Memorial Community Hospital specializes in kidney dialysis treatment and chronic obstructive pulmonary disease, which have both been utilized extensively by Missourians in our communities since they were implemented. We have since introduced more occupational injury specific services and therapies after learning that our community was having to drive over 2 hours to the next nearest rehabilitation facility to seek the care they needed. In order to listen to what the people of Keene need, we partnered with Future Farmers of America, Keene Community Insurance, National Farmers Union, and DaVita Dialysis Clinic. This has allowed us to bring the best possible care to rural Missouri while keeping our roots strong in Keene. In order to best serve our community and provide the highest quality care, we introduced a vaccination policy requiring all employees to show proof of flu and measles vaccinations at the beginning of their employment, and then requiring them to maintain their flu vaccination every year. Catering to our community's needs through the services we offer, as well as providing the safest possible care, is our main priority at the Memorial Community Hospital.
Because we cater holistically to our community, we are in need of funding to expand our budget for the 2021 fiscal year in order to continue providing these essential services to Missourians. We are seeking an increase of $2 million in state funding for MCH to reduce our budget deficit. Our current budget deficit is unsustainable and needs to be managed as soon as possible. This would allow us to expand our capacity to meet the emerging needs of the community we serve while only needing a 5% budget cut in non-essential areas. Our only current option without the increased state funding we are seeking would be to cut the number of nurses and physicians, cut the overall salary of our staff, reduce upkeep costs to the bare minimum, and reduce the amount of services we offer. Our already short supply of nurses and physicians would be restricted even more. Our staff would have to be increasingly stretched out to meet the increasing demands we are seeing from our community and our services. The ability to hire any new staff would be affected, as we would have to decrease any recruitment incentives we can offer. For a rural community and provider, recruitment incentives are vital to motivating those with the necessary skills and knowledge to move to your community and operate there. The amount we can spend on repair and maintenance of our facility would be cut, and over time, we would see the wear and tear on our facility and equipment accumulate. This means we will no longer be able to keep our facility to the standard of quality that we feel is sufficient for our patients' safety and satisfaction. We would also see our family planning department shut down. Mothers all across our community rely on our family planning department for pregnancy resources and information, and we would see a noticeable negative impact on the health of our children as a result.
Thank you all for your time here today. We sincerely hope that you will consider increasing funding for Memorial Community Hospital so that we can better serve the community of Keene, Missouri. Since 1970, our job has been striving to provide the best care possible for our patients. We are the sole general provider in our area that our community members rely on for essential medical services. We need to be able to meet the increasing demand for the treatment of dialysis, COPD, and workplace injury that we are observing within the community. Expanding our efforts and ability to treat those increasingly prevalent health issues will need to be put on hold indefinitely. Without this state funding, we will not only be unable to expand our efforts as a provider, but we will have to make budget cuts at the detriment of our ability to operate. We want to advance our community's overall health and well-being by providing accessible, affordable healthcare for Keene, no matter their needs. With this increase in funding, we feel that we will be better equipped to serve the needs in our community.